Someone had a really good point that when I talked about what death looks like and the symptoms, that was good, but they really wanted to see if I could show them what death looks like with a visual. And that was a beautiful point, and I completely agree. So I'm going to talk about a video that I'm linking to in the comments down below, in the description down below. And I want to give you a little bit of description of it. And my whole goal with this is to hopefully give you some sense of comfort about the end of life dying process and what it can look like for you or your loved one. All right, I'm Abigail. We're here to normalize these conversations and education about death and dying so we die better at end of life. Let's get into it today. This video that I'm posting in the description is a video that's already on YouTube and has been on YouTube, so it's accessible to everybody. And it's someone who posted the video of their father who was in the very end stage of their dying process. And it's of an elderly man who is in a bed. His head is a little elevated. His head is on a pillow. He's wearing a hospital type of gown, and he's got some linens, some sheets and blankets over him. His head is a little bit turned away from the camera, so you don't see his full face completely, but you can see the right side of it. And it seems like he's someone who is resting in bed with some of the cardinal signs of the very terminal stage of the dying process. And so there are just a few here that I'm going to point out that are really salient and really present here. What you'll see, what you'll notice is that his facial structures are a little bit different. You know, when we sleep, we can sleep with our eyelids closed, we can sleep with our mouth closed and breathe through our nose. In this video, his eyelids are a tiny bit open, even though you can't really see it, and that's very common. You know, everything in the face at the end of life has really relaxed quite a bit. Everything is weakened, but everything is also very, very relaxed, especially when someone's comfortable. This is a good sign. This is a sign that somebody's really resting into their body. They're very comfortable. So the eyelids are not going to be necessarily fully closed, so you may see them a little bit open, and the eyes can sometimes either focus straight ahead. In my experience, I've seen them kind of look up a little bit. The mouth is often open, and kind of, the face can even seem a little drawn. The chin might be a little bit back and kind of sunken down, and the person is breathing through their mouth. I don't hear a death rattle with this, and I will be discussing that in another video, but I really want to focus on what you see here in this video. So he's breathing through his mouth, and you may notice that his breathing is a little bit kind of almost like a big sigh, and then he has a period where he's not really breathing, and we call that agonal breathing. And what you may notice is that he's doing kind of a big it's kind of like a big sigh type of breath, and then he's having a period where he's just not breathing for a moment, and then he'll have another big breath. And what will happen is that rate of breath will gradually continue to slow down to the point where he stops breathing at the time of his passing. So you will notice these kind of main things. And what I really want to emphasize to you here is that this man is dying very comfortably. He's dying very peacefully, dying very comfortably. Now, I'm not there to do a physical assessment on him to, measure his heart rate and things like that, but looking at how the fact that he's very, mostly relaxed in the face, he's not showing me the objective signs and symptoms of discomfort, respiratory distress, anxiety, things like that, looks to me like he's very comfortable. This is a patient where in my previous, when I worked at the bedside or as the clinical director, going out with my staff and seeing patients or very complex cases, this is where I really want someone to be at the end of life when they were dying. So this is why, on a side note, you'll always hear me say this, you really need to have hospice, because this person looks great, but he might have had symptoms that needed to be treated. And so once he was treated, he was looking like this. So this is a very good situation to be in at end of life, dying comfortably like this in a bed and not having any signs or symptoms that are causing distress. And this sure, people can die like this, but you really want the assurance that not only are you going to die comfortably, especially if you have symptoms, you want them treated by the professionals at end of life, but you also need to remember that hospice is a lot for the family as well. So the family who's sitting at the bedside, they're being treated as well by the hospice team and all the different type of hospice staff that are coming to visit the patient. So just a little plug for hospice. I don't plug anyone, hospice in particular, of course, but I really want to make sure you utilize your hospice benefit, because you can die very comfortably like this man did. Have a watch. Let me know what you think. Let me know if this at all provided any type of comfort for you, because the whole point of this was to give you a little bit of exposure, especially if you have a different experience with death, or maybe you haven't seen someone die before. And exposing your nervous system to this really helps us to be a little bit more prepared, and also helps us internally with our feelings of anxiety and fear around it. So let me know. I'm really curious to see if this helped you at all, and if you found this valuable, because that's the only thing I want to do here. All right, take care. We'll talk soon. Let's continue to normalize these conversations and education about death and dying so we die better at end of life. I'll talk to you soon.